Hello, everybody. This is Pharmacist Michael, Pharmacy Mike, and I have Marissa with me here today. Hi, Marissa. How are you doing today?
I'm doing good. How are you?
I am doing great. So I want to ask you a few questions today about gastroparesis and tube feeding and whatever else you want to talk about.
All right.
So, how did your condition come about?
I had a hysterectomy on my 26th birthday. After I had the hysterectomy, my GI system went to bed and just never woke up.
And how long ago was that?
About 3 years ago.
3 years ago. Okay, so and you've tried what so far?
We've tried erythromycin, Reglan, Motegrity, things like Linzess, I'm sure there's more that I'm forgetting, but medication ended up failing me to the point that I was so malnourished that some people, when they first start tube feeds, they get an NG or an NJ. I went straight to surgical tube placement.
Okay. So how has this, besides the obvious, how has this changed your life?
Um, I am on, because of my feeding rate, I am on 23-hour feeds 7 days a week. So I get an hour to myself to like shower and do my hair and stuff. But I always have a backpack with me with my feed stuff in it. I can't take medications by mouth. They all go. I can't. Like if I'm drinking something, it obviously goes into my stomach, and I use a Pharrell bag. For most people use them to let the air out of their stomach. Mine gets dropped on the floor and my gastric contents run into it, because if I don't, I can end up with an intestinal blockages.
Okay, so do you ever eat food just for the pleasure of eating food?
Yes. I eat food for pleasure, and I eat food because I'm a human and I do have cravings.
Right. Okay. I don't know if you saw the interview that I did with Julie.
No, not I haven't watched it.
Okay, she brought up something that I have never even thought of, and she said that people don't like to be around her because they feel guilty when they eat because she can't. Have you ran into that at all?
Um, I don't, kind of and kind of not. Like, I don't like situations where food is involved, that I know for a fact that I'm not going to be able to drain the food. But nobody has ever like told me that they have felt guilty or anything like that. But I'm also a person who we all know is going to live their best life despite having a tube.
Right. Okay, and what type of struggles have you been through as far as the healthcare system goes?
It took a while for me to be heard. Going, hey, like this isn't working. Hey, this isn't working. Um, it actually took my gynecologist to be like, I think this is the problem.
Okay.
Uh,
Go ahead.
so, you get referred to GI, well, he referred me to a PCP who was like, okay, I think that's the issue too. You get referred to GI. GI was like, well, we don't know. They wouldn't even test me for GP. So I went to Philadelphia where they did an emptying study that came back absolutely horrendous.
So
Um,
what were the results of that study? I thought the last time we interviewed, you mentioned something about it.
I hold on to approximately like 87% of my food in my stomach. At
So
the
it just stays there.
It stays there, it doesn't move.
And does that make you sick
Yes.
if you
If
don't drain it out?
so the food is going to come out of my body one of two ways. I'm either going to vomit or I can drain it. There are some foods that just aren't drainable, like red meat, not a drainable food. So like steak isn't something that I really go after, that I really, now mind you, before my tube, I liked it kind of, but now it's not something that I want to taste the second time around.
Right. So does your formula stay the same or does it change?
So I have been through 3 formulas. The first formula I was on was called Osmolite 1.5. It's basically like Ensure, but it has no flavoring to it. You get it by prescription. It's delivered to my house by a medical supply company. My second one was called Vital Peptide. It's a formula that is more broken down, easier to digest. The equivalent would be like Similac Augmentum or Nutramigen. This is the formula that I'm on now.
Okay.
It's called Care Junior. It is a formula that is intended for children, ages 1 and up, but it's an amino acid based formula, meaning it's so broken down that you can't break it down much further than it's already broken down. I don't even think it's possible to break it down.
Hi, Twinkie. I see you there. If you have any questions, Twinkie, be sure to ask them. Can you see the questions, Marissa?
No, I can't.
Okay. So if I see them, I will read them to you. So
Okay.
I wasn't sure how this worked because I haven't been on the other side of it. So, okay. So my next question for you is, what would you tell somebody? How would you know if you had gastroparesis, or what are the symptoms that you had that cause you to seek medical care?
So I was always vomiting. I would eat a few bites of food and I would be very, very full. Like, you know how like when you're like enjoying a meal and you know that you're full, but it's so good you just keep eating and eating and eating. Well, after a few bites, that is what I would feel like, and it would hurt. Um, to the point where I would just go to bed, I would be in tears. I was in and out of the emergency room to the point where like most of the doctors and nurses there, they know me by name.
Okay, and you say that you thought or you think that this happened because of a surgery. Did this happen immediately after the surgery, like the first time you started eating?
No. So, when I had the surgery, I stayed overnight. Um, I went home the next day. Wednesday, I called my surgeon and I was like, "Hey, I really don't feel good." I didn't have an appetite at first. Um, and he was like, "Let me call you in some Zofran or ondansetron, sublingual. Let's see if that works. If it doesn't work, call me on Friday and we'll go from there. So Friday, I still wasn't feeling well. I was felt very, very off. So Friday, he met me in the emergency room, and we did a CT. In that CT, my pelvis was filled with fluid. They couldn't tell if it was like infection. They couldn't tell what it was. I was admitted at that point. They had everything on board, pain meds, you name it. Pain meds, fluids going. And then on Sunday, they did another CT where I was even more full of fluid and pelvic ascites, basically.
So before Twinkie's asking, before the surgery, you were completely normal.
Yes.
Oh, wow. Okay. So you've been to GI specialists.
Yeah.
Your gynecologist seems to be the one that helps you the most, which is I find that odd, but it's great that you have someone that will help you.
I also have since my OBGYN, he did contact a PCP, phone called him and let him know, because I'm very, very antsy about seeing new medical professionals. He talked to him, gave him my story, and my whole medical team will tell anybody that I'm a very, very complex case. So even though it happened after a surgery, they do call my gastroparesis. Some people get it from being diabetic. Mine is called idiopathic gastroparesis, meaning they don't know why it happened.
Are there other things? I did read about diabetes, so I know that's the major cause, but are there other things besides diabetes?
I heard there's there's diabetes, idiopathic, it's was I have, and there's surgical gastroparesis, where your vagus nerve in your body is messed with, and that can offset it. But as of now, we don't think mine is a surgical case, because I was having a hysterectomy. So I was having, even though my abdomen was kind of involved, I was having a pelvic surgery.
So is this just your stomach, or is it your entire digestive system?
It's my stomach, it's my intestines, and it's my colon. My colon, I have very, very little motility, almost to the point where they think that my colon is failing across the board.
So do they think the surgeon caused this by making a mistake?
No.
It just happened to be, hi, Kat, I see you.
I just happen to be that 1 in a million person that it happened to.
That's so unfortunate.
But I didn't blame my surgeon. I don't blame my OR team. They were absolutely fantastic with me there.
So take me through a day in Marissa's life.
So I get up, I shut off my feeding pump. I disconnect from my lines, and I start my day by getting small humans ready for school. They eat breakfast and lunch at school, because here we have a Title X program, so we don't pay for breakfast or lunch.
Okay.
So then I get them off to school. I will I'll shower, I'll make another feed bag, so my feed bags are 500 milliliters. So I'll fill up it's a Dr. Brown's formula pitcher that mixes powdered formula. I get 17 scoops of formula to make my caloric intake. I'll mix that with water. I'll dump it in a bag, hook it up to, I use the Infinity pump. They also have like the Kangaroo Joey pump. I hook it up. I put it on an IV pole, and then I take a straight extension. I put it into my gastric port because I have a GJ, and what that does, and then I hook it up to a Pharrell bag, and what it does is if I hang it up high, it actually burps for me without me audibly burping. It sucks the air out of my stomach and vents it. If I take mine, I drop it on the floor, and it lets my gastric contents come out because they don't go anywhere but sit there.
How did you learn how to do all this?
Um, Friends, the internet. I had a really good, before I had my feeding tube placed, I had a PICC line. My PICC line was removed a couple of months after my feeding tube was placed because I had bacteremia, back to back. So I had it in February and I had it in March.
Okay. And do you think that was caused? That's probably not caused by the feeding tube, though, is it?
No. So when you have a PICC line or a central line, everything has to be done under sterile procedure. I had a nurse who had an attitude problem who came in, who was mad that she had to come. She drove from Penn State, Altoona, all the way into where I live in the borough. She didn't like that very much because my nurse, he told me as long as I would agree to a 7:30 a morning appointment, that on his way in from up the mountain, he would just cross through Hollidaysburg and here first. And so once a week, I would have my dressing changed and stuff. But I had a nurse break sterile procedure, and not soon after that, my line was infected.
Oh, boy.
Um, so I went on Rocephin. I got to, because I had a central line, I did my own Rocephin at home. Then a month after I did Rocephin, they checked my ultras again. My home health nurse came in. He did all of my blood work. It came back that I had bacteremia again. And then this was a Friday. He came in. On Saturday, I was on the phone with one of my friends. We were FaceTiming. She could see how heavy I was breathing, and she's like, "You need to go to the ER."
So, since you've had this problem, how many times have you been hospitalized?
Honestly, I have lost count.
It's a lot.
Yeah, it's a lot because every 3 months, unless my GJ breaks, so if my GJ balloon would pop, I would have to go to the ER because I'm not scheduled to have it changed. But every 2 to 3 months, my GJ tube has to be changed because they get gross and disintegrate. My last one was changed last Wednesday, and that was about the most traumatic change I've ever had. The doctor himself did it, but I waited 5 hours in the ER before they could find a nurse who was sedation trained to give me those types of medications, because I waited 5 hours in the ER with nothing in my stoma. My stoma closed, and I had two nurses at my arms and one above my head wiping my face. The two nurses at the sides of my arms were actually holding my arms in the sides because instinctively I went pushing. I took my hand and I went pushing at the doctor to get him away from me because they were trying to stick dilators into my stoma, which was extremely painful because it closed shut. So they had to take my stoma that was closed to a back up to a 22 French to get my tube stuck in there. Finally, towards the end, they did get the very smart idea to put lidocaine around my stoma, so I wasn't feeling as much because I sat there and screamed at the very top of my lungs.
Okay, I want to change directions here a little bit because I've known you for a while, Marissa, and I know that you are probably one of the best self healthcare advocates I've ever met. What advice would you give to somebody with no healthcare background? What advice would you give them to help them navigate the healthcare system and get what they need to get when they know they're getting the brush off, or they feel like they're not getting the care that they should get?
So when before I was chronically ill, I can say that I never really went to the doctors. Like, good luck getting me to get a checkup. But when I got sick, I absolutely stand my ground. Because I know in the healthcare world, most females who come in with a problem like anxiety or nausea and vomiting, well, when you come into the healthcare system with a problem like, oh, you vomit, as a female, it's most likely they're going to be like, oh, you have anxiety or oh, you have depression. And so I very much do have anxiety and depression. I take medication for them every day, but stand your ground. Don't let somebody go, well, I'm not going. So you go in and you're like, hey, I was looking at this. I would like this test ran. And the doctor goes, no. You look at the doctor and you go to him or her or they. You go, write it in my chart why you are refusing this testing. That normally will get your doctor on their toes.
Okay.
I am very, very fortunate to have providers who will listen to what I have to say and take into account of how I'm feeling, what's going on, whatever I need, they take into account.
Were they always like that though, or are they like that because they know that you're going to push if they don't listen?
They're not always like that. Sometimes I will have to be like, hey, I need this because of this. Like, I will have to explain my reasoning on why I think that I need this specific type of treatment. Like, when I had my PIC line, I had to explain to them that I wasn't drinking more than about 4 to 6 ounces of fluid a day. And once they realized that, they were like, oh, but you have to push, but you also have to be tactful. You can't go in and need a treatment or think something's wrong with you and start flying off the handle at your provider.
Right.
You have to approach it in a very, very tactful manner.
And how much research did you, I'm assuming that you've done a ton of research on gastroparesis, tube feeding, stuff like that.
Yes.
So before you ask for something, you have a good idea what you need or what you want.
Yeah. I do my due diligence and research.
What about second opinions, third opinions, fourth opinions? Hi, Janet.
So my OBGYN and my PCP, those are first opinion doctors.
Right.
I very, very much trust the both of them. GI, we have a GI system right in our area. They said I was too complex. They weren't touching me. Um, Even to the point where when my first tube fell out, nobody was really taking care of my tube changes. I had to call my PCP and be like, hey, I'm in same day surgery and they have no orders to replace my tube. So um, I got a call in same day surgery recovery area being told that I was kicked from that practice. So I found a new GI. I went to got a referral to him. We didn't see eye to eye. The rest of the GI system in Philadelphia were like, we don't know. So now I see a colon and rectal surgeon. That is who takes care, who researches my GI issues.
Okay. Hi, Lisa. Welcome in. If you ladies in here have any questions for Marissa, please ask them. That's why she's here. I want her to explain some things.
I'm very much an open book. You can ask me just about anything.
We've got Janet, Lisa, Twinkie's here, Kat's here. There's more, but those are the ones that have actually. And if anybody wants to be interviewed, I'm going to put a banner up here. This is the first time I have used this program. So I am going to put my email up here for you guys. If anybody wants to be interviewed, and I know, Kat, you already want to be interviewed. So you don't have to tell me. I already know. Okay, Marissa, next question. Is there any silver lining to these things that have happened to you?
For me, the silver lining is even though I don't eat the same as other people, the silver lining for me is I'm still here. I'm still walking the earth. I'm still alive. Does it take me longer to get ready? Yeah. Um, do more often than most people? Yeah. But it doesn't, I don't let the fact that I have a feeding tube hold me down.
How did this affect your husband? Did he have any? How did he react to it when he found this out? First of all,
He is very, very easygoing. He was very supportive. Whatever I needed, he was there.
okay, good. And he's still like that, I'm assuming.
Yes, very much so.
So you still cook for your family, right?
I still cook. I still clean. I do laundry. Um, I don't let when I am overwhelmed and tired, I will tell my family, hey, I'm gonna go take a nap for an hour and lay down. But I don't let it affect me to the point where my illness is my identity. I know that there are some people who have chronic illnesses who will make it their entire identity. And why it's not my identity, it's just a part of me.
What are your go-to coping skills when you
Um,
wake up in the morning and you feel like God's not fair and why did this happen to me? And because I know that's got to happen to you at some point.
um, I will, my go to coping skill is I will take a walk. I will go to my favorite coffee place and I will sit in there. I'll have some coffee, and that's normally how I cope.
Okay.
I like to be outside. The fresh air helps. Um, if it's like a rainy, crappy day, which takes a toll on your body when you have a chronic illness, like I know it's going to rain before it rains. I will find a series or a movie and sit in bed and watch it and just live my best life.
Okay. And does it affect your kids at all?
Um, my kids are very, very great about people who are um so we don't like to, so people who are disabled, we like to be called disabled across the board because having a feeding tube is considered a disability. Um, my kids are great with it. They don't let it affect their daily life. Um, they're very helpful. If I ask my oldest daughter, "Hey, can you go grab me a can of formula?" She grabs me a can of formula. Whatever. Like my kids know where all of my like not like medication. So, but like my formula, um, my the syringes like this. They're only meant for feeding tubes. They're called NFIT syringes. My feeding bags, stuff like that. They can bring it to me.
Do you think that your chronic illness has given them more compassion for other people who are disabled?
Absolutely. Um, I know so I feel it in my heart because my kids see a disability firsthand at home that they are more like they are more likely to befriend a disabled person than the average student would be. My kids go to public school. So I remember my daughter coming home from school. She's a seventh grader this year, telling me how they had to pair up with the kids in the special needs classes at the junior high where she goes to. And they created a dance together, and she absolutely loved it.
Is it something that you taught them, do you think? Or do you think that they just learned it because of you? I mean, have you ever had to tell them, don't stare at that person?
Yeah.
Um,
So I've always told my kids to be accepting of other people. One, because one thing can turn your life upside down. You can get into
yep.
an accident, you can lose your legs. It only takes a split second for something to change your life drastically. So I've always been an open book with my kids about acceptance and that we don't all look the same. You know, like for me, for instance, I don't eat the same as everybody else. Um, some people don't breathe the same as everybody else. Like they have trachs.
Right.
Some people are paralyzed or in wheelchairs. There are some people who can walk and they're ambulatory wheelchair users. Um, but I just, it's always been very, very open in our household that not everybody is the same. We all have struggles, whether you can see them or not. Um, if I would put on a sweatshirt and didn't have a backpack, it didn't have my feeding supplies, I would look like a normal person.
Well, you are a normal person.
Well, I would look to an extent, but I would look like if I put a shirt on that didn't show my tube, which is right here,
Right.
or, whatever, and I didn't have my feeding supplies hooked up to me, and, I walked into like Walmart, I would look like a able-bodied person. But
Twinkie's asking you if you can drink, or can you drink by mouth, or can you just not eat?
So I can drink by mouth, and when I
Okay.
drink, this is the tube that will take it all down and out. But
So it's not,
it
so
does,
all your hydration is also coming from the tube feeding. It's not coming from what you drink.
no,
Okay.
very much comes from tube feeding. Like I even found out we're waiting for the dietitian to sign off on it through my home healthcare company. I have to go on, I'm protein deficient, so I have to go on a protein supplement.
Okay.
It's called Pro Source, and you just squeeze it in with your feeds, shake the bag up, and call it a day.
Do you have to leave that on for 24 hours? I think she said, didn't you say you have an hour?
So technically, on all technicality, my feeds are 24/7. But so I split them in half, and I do 12 hours at a pop. So the feeding bag I'm running now will run till about 7 o'clock tomorrow morning. And then I will make another 600 milliliters of feed. I will put it in the bag, and for 12 hours, I'll put it in the bag, and for 12 hours, that'll be my day. The reason why I say 23 is because it would be kind of nasty if I didn't shower. So,
Okay. But I got a question for you though. Why couldn't you just run your calories in 3 different times like people that are eating? So why couldn't you just do like a breakfast feed, a lunch feed, and a dinner feed and then not do it at night?
so the reason why I can't do that is because so I'm fed in straight into my intestine. So we bypass my stomach. Um,
Right?
So when I first got my tube, my rate was supposed to be, they work your rate up every few hours. My rate was supposed to be at 80. And that would let me on just overnight feeds. I could go to bed, hook up, and be done. Well, when they got me to 80, it was very, very painful. My intestines would seize up, and they had to lower it back down. And I got to the rate of, so I get 45 milliliters per hour. So essentially I'm getting less than a newborn baby would eat. So because my rate is so low, I have to be on feeds this long.
Got it. Okay, now I've got some questions for you, and I'm glad because I want them to ask questions. So Janet says, did your kids handle this just by intuition, or do you have a suggestion for someone who's struggling with fear of mom's illness?
So my kids, I came home, and we just explained what happened. My kids were very, very helpful. Um, but they're very, very intuitive to me. They know when something is wrong. Um, my daughter, who will be 13 on the 4th of July, she came into my room and found me having a seizure, because we found out, later I had very, very low blood sugars. So soon after that, I was diagnosed with reactive hypoglycemia. But my kids are very, very in tune to me when something is off. They will tell me before I even know it. Like, I wear a Dexcom. My daughter can walk up to me and go, Mom, your blood sugar's low, before I am even alerted to Dexcom. I have a husky. She's not trained as a service dog or anything. When something's off, she will come up to me and be like, Hey, Mom, I know something's wrong. And she'll just kind of sit at my feet and follow me around until I figure out what's up.
Okay. Next question. You said your colon is failing. Will you have to have a colonoscopy bag in the future?
So at this point, we don't know. Um, I do have a colorectal surgeon. That's the last thing that we want to do. But there is a surgery where they can actually take out my colon, loop my small intestines, and hook it to my rectum. So I can go to the bathroom like a normal person and not have an ostomy bag connected to me. But in the meantime, while your insides are healing, you do have an ostomy, so your body can heal.
But that's down the road. We don't know.
We don't know if that's going to happen. There is a couple of tests that they want me to do, like a manometry test. They were talking about a SITS marker test, but because I can't consume a lot of liquid, they took that off the table.
Do you just do formula or do you do electrolytes too?
So I do formula mixed with water. Sometimes I will go and use plain Pedialyte and mix my formula in with it, but that's about the only way that I'm getting electrolytes because my body doesn't absorb like your body does.
So how are they stable then? I mean, your potassium and your sodium and all those things, how do they stay within range?
My formula it's complete. It's nutritionally complete. So it has fats, it has carbohydrates in it, it has vitamins in it. Um, I get I have a liquid potassium supplement that I can add right into my feeds. Sodium's in here, chloride's in here, like iodine, all my minerals are in here. But this is how I get what I need.
And that's a new formula for you, right? Didn't you just change?
Yeah, it's in.
Okay. Oh, wow. Okay. So if somebody wants to get a hold of you, let's say somebody's watching this and they're just starting tube feeds, or they think they might have to, and they're scared, or they don't know how they're going to be able to figure this out, or they just want somebody to talk to. How would they reach you?
So I have an Instagram, I have a TikTok, and I have a Facebook. Um, I get message requests on TikTok all the time. Um, I'm sure Mike can put my handle in, and 9 times out of 10, I will give you my phone number so you can FaceTime me, call me, text me, whatever. I'm very, very, texting is my least favorite. I do like to talk on the phone. It is easier
Right.
because texting, you really don't know somebody's tone
Right.
and you don't know if they're being sarcastic or whatever. But so I prefer like FaceTiming. I have Google Meet, I have FaceTime, and I have calling.
Have you thought about writing a book about this?
Um, I have and I haven't. It would be a good book to write.
I think it would be a good book
Yeah.
because I think I think you have done very well through this, and I know it can't be easy, but it's one of those things that your story shows that you can basically get over anything. And a lot of it is attitude, right? It's the way you think about your situation.
A lot of it is attitude. A lot of it is attitude and mindset. You know, if I wake up and I'm like, oh, I have this tube, you know, I can't go do anything with my friends, you know, that's my own attitude. I'm not gonna let, you know, having a tube stop me from doing anything. I model for a local boutique.
I know, I've seen the pictures.
And I wear a Dexcom. I have a feeding tube, and they were very much shown in the pictures. They did not cut it out. They did not hide it. That was very much a part of. It's very much a part of me and who I am. But it's not my identity. I have seen people get diagnosed with something and let it consume them to the point where it was their identity. And I've had to explain to people, you know, you have an illness, but it's not who you are. It hasn't changed your heart. It hasn't changed your mindset. Is it going to slow you down a little bit? Yeah, it's going to slow you down. I'm not going to tell anybody that my illness hasn't slowed me down. It absolutely has. But contrary to belief, I still go hiking. I like to go outside. I'll go hiking. We have a state park near our house. I walk my dog. Um, I live in a borough and I'm very, very close to like local shops and stuff. And I will walk all through there, um, and go to different stores and check things out. But I don't, I still, a couple weekends ago, you know, we went to eat, and, you know, despite the fact that I really can't eat, I still did try,
Right.
but I most certainly drained it after I was done.
Right.
Um, but no, I don't let it. The mindset I have is I have an illness. The illness doesn't have me.
Right.
I'm going to do whatever I want, come hell or high water.
Yeah, I mean, I think that a lot of people worry and think about things that are so much less than this is, you know. I
Yeah,
mean, I could complain because I didn't have any hair on my head, or they think they're overweight, or they don't look as good as their neighbor, or they don't live in a nice house, or, you know, I could go on and on and on.
yeah,
But at the end of the day, none of that matters. What matters is how well you treat other people, you know, and really how much you help other people. And I don't think God makes mistakes. So I know you guys have heard me say that a lot on my lives, but I believe everything happens for a reason. So Janet's got another question.
okay.
Does your hunger get satisfied with the formula? Is it hard to be around food when you can't eat it?
So I have had a feeding tube um over a year now. I don't have hunger cues anymore. Like, I don't get hungry, but I will have cravings for different things. So, as long as I can drain it, I will eat it. I have even used the chew and spit method, which a lot of people who are tube fed and have GP as severe as I do, we will ask, like, not in a restaurant, but you know, at home, we'll take like a red solo cup, we'll chew the food, get the taste and the flavor, and spit
Yeah.
it.
Is there anything that you absolutely cannot eat?
Um, so anything I absolutely cannot eat. So, peanuts. Cannot eat peanuts.
Okay. Or any kind of nut, right?
Um, I'm okay with hazelnuts, but peanuts is a very, very big one for me.
Okay. Is it
And
because you're allergic to them, or is it because they get stuck in your stomach?
I developed a peanut allergy like right after being diagnosed with GP.
Oh,
Red meat is another thing that I absolutely cannot swallow because it will not digest. And it can cause me to have an intestinal blockage. So that is one thing I do steer clear of. Um, but that's about it. Um,
is it hard to be around food?
in the beginning, it was. I didn't like to be around food involved events, but as things went on, I was just okay with it happening. Like, it didn't bother me. Like, I'm still getting nutrition. Is it the conventional way? No. But if I want to try to like curb like a craving, I have the ability to do that. But I don't eat like the rest of the people do for like nutrition and hunger and stuff like that. I eat for pleasure because one way or another, unless it's the formula going into my intestines, it's leaving my body.
Right. Okay. What advice would you give people about anything? What is Marissa's advice on life?
Um, my advice is to have a good attitude. Things in your life are going to happen whether you like it or not. I didn't, wake up one morning and wish upon a star to have gastroparesis, but hey, it happens. So have a good attitude, have a good mindset. And if you believe that there is something wrong and nobody is hearing you, get second, get third, get fourth, fifth, sixth, seventh opinions. Somebody will hear you and be like, okay, this is a problem. Um, but
And one thing is, I don't know if you saw Becky's interview on the ketamine, but another thing is you just might find a doctor who's seen it before. And I think a lot of, doctors are really good at things they see all the time.
yeah,
An emergency room physician is super good at heart attacks. They're good at trauma. They're good
yes,
at diabetic ketoacidosis. They're good at stuff like that. But if you've got something that they've never seen before, then it's different, right? And
you,
sometimes you have to get seven opinions to find the doctor that has seen what it is that you have.
yeah, very much so. Like, for instance, so gastroparesis is only one of the rare diseases that I have. The other rare disease I have is called ovarian remnant syndrome. And ovarian remnant syndrome is normally a surgical error where the surgeon lets ovarian tissue behind. Well, in my case, we figured out very, very quickly it was not a surgical error because, I had my hysterectomy. We left the only ovary that I had at the time in my body. It started causing problems. He went in, he removed it. A couple weeks later, they told me I was going to have hot flashes and go through menopause and stuff. A couple weeks later, I called my provider and I'm like, hey, all this stuff that you said was going to happen to me isn't happening. So he's like, okay, let's go get an ultrasound. I got an ultrasound, and it very much looked like I had an ovary. But, I was there for the surgery when he removed it. Um, so he removed it, and not long later, I called him again, and I'm like, menopause still isn't happening over here. So he we went ahead, we did more imaging, and on my left side, I had another ovary.
Did he not see it when he was in there?
This one wasn't there when he was in there to remove.
Oh,
They just kind of appeared, you know.
are
So,
they still there?
so I had two removed. So my first one grew on my left side. My second one grew, no, my first one grew on my left side. The second one, no, I got them backwards. So first was left, then was right. No, it was right then left, because when he took my left ovarian remnant out, which was big enough, it looked like an ovary. Like when they marked it down in my imaging from the radiologist in my chart, they marked it down as I had an ovary with no fallopian tube. Um, so we scheduled surgery to remove that, because at this point, um, I have had extreme chronic pelvic pain. So he went in, he removed that. When he removed that, he was peeling it off my sidewall. My iliac vessel ruptured. Um, and in my op report, I read where he was telling the anesthesia team to prepare for mass blood loss. Um, I have so this scar right here, the real dark one, it goes down to the top, it goes down through my belly button. That's my feeding tube scar. Below that, down onto my mons pubis, is the laparotomy that they performed to pinch off my iliac and sew it back together and essentially save my life.
Wow. Do you think that there's any connection between this ovarian disease and the gastroparesis?
No, but I can say that I am, as far as we know, that has been reported, I am the only person who has grown 3 ovarian remnants on top of having my 2 original ovaries. So I make the joke that I have had 5 ovaries. My third ovarian remnant, it kind of just disappeared on its own. We kind of just left it go to see if it was going to grow, disappear, and it just shrunk down on its own. But I'm still not, my estrogen levels will tell you I'm menopausal, but I don't have hot flashes. I don't have cold flashes. Like, I don't have typical menopausal symptoms. I'm also not on a hormone replacement.
So none of that ever happened. You never got menopausal symptoms at all.
No.
Wow, that's interesting. Okay, is there anybody? Do you guys have any other questions for Marissa?
I'm open.
She likes to answer questions. I know that. Is there a food you miss?
Honestly, not really. Because so my motto was, when I first got sick, that if I vomited it up, I'm never eating it again. I don't like to taste food the second time around. So there's really not a food that I miss.
Well, Kat, you have to be able to handle menopause at some point. That's part of getting older. So you're gonna have to find a way to make it through. I'm sure you can do it.
So a lot of people make menopause to be this horrific thing. And honestly, from the stories that I've heard, it's really, you know, some people experience hot flashes and hot flushes where your face gets all flushed. Some people experience being cold. I'm very, very unique. I am what they call a one in a trillion case because I don't experience things like most people would. But as for going through menopause, it's not going to be the worst thing to happen to you. They do have medications at this
Yeah.
point in time that will help you get through it.
She is inspiring, isn't she, Janet? I know. I couldn't wait to get her on here. She was actually one of my very first, I think you were my very first podcast
I was,
guest. You were the second one. Oh, that's right. Okay. You were the second one.
yeah,
Yep. She is inspiring, but that I'd like to talk to people that have came through the other side. A lot of people think they've got a hard life, you're pretty resilient. We all are.
yeah.
You
A
can get
lot
through a lot.
you can when you have a chronic illness, as I said before, a lot of people will identify with it. And I never started to identify with my chronic illness. It's a part of who I am, but it's not me. Like, my name is Marissa. My name isn't gastroparesis.
That's right.
My name isn't ovarian remnant syndrome. Um, I've never left any of this hold me down. I still go and do the things that I want to do. Um, do I go to the hospital a lot more than most people? Yeah, I was there this past Wednesday because my tube fell out and I had to get it replaced. Um, some people get their tubes replaced with no sedation. They just go in, they slip it in, and that's that. I'm a very I'm very positive, but when it comes to like getting things changed and stuck into my body, even though like I already have this, I get sedated for it because for me, it's not a comfortable procedure.
They
But
all want you to write the book, Marissa. And I agree with them. I think you should.
I'll, that will be something. Maybe this summer I'll start looking into publishers and stuff and
Talk
see
to Jetty May. Talk to Jetty May. She's done it.
um and see if I can pitch an idea.
Because you, well, your idea is you've got a chronic illness that you made it through, and you can give people coping mechanisms are a big thing. We always come back to coping mechanisms because, like I always say, whoever you are, no matter what your life is like, sooner or later, you're going to need them. And the earlier you learn them, the better off you're going to be.
Yeah. Being able to cope with something and having coping skills is one of the best things that you can do.
I
And
think it's the best thing you can do to prepare yourself, because otherwise you're going to end up on anti-anxiety, antidepressant drugs for the rest of your life, or worse.
now I will say I have coping skills. I and stuff like that. But I am still my brain does not produce enough serotonin. I am on an antidepressant. I am on an anti-anxiety med. But those are tools to help me because I have been through so much trauma with the healthcare system where there are sometimes I have my providers will fight with me to go to get seen. My last hospital stay was in March. I went in for a doctor's appointment, and from that doctor's appointment, when I left, I was directly admitted to the hospital for 3 days.
But even if you are, and I understand that there are people that definitely need antidepressants, and anti-anxiety meds. The
Yeah.
problem is, even if you have them, if something really bad happens to you, you still need the coping skills.
Yes, very much so. Having an anti-anxiety medication doesn't automatically make everything better. You still need to be able to cope through what is going on, what is happening.
That's right.
Um, like for instance, on Wednesday when I was having my tube changed, I was given Versed, I was given fentanyl. Those are sedating medications that they use. Um, most people will tell you on Versed that you're supposed to experience some sort of amnesia. I don't. I can tell you everything that happened from the beginning of that day when I went
Wow.
ER and from the when I came home.
Do you meditate?
Um, no. That is one thing I don't do. I've tried it. Um, but it's not something that I like. One of my favorite things to do to cope is to dance. I will dance through my house like nobody exists. But I spent from the time I was 4 through high school, I danced. It was one of the greatest things that I've gotten to do.
And music.
Yes,
Music is one of the best coping mechanisms there is. People don't realize that, but it is. It's one of the best.
music, I like to dance, and you can look like a complete fool dancing. It doesn't matter. You're in your house, nobody can see.
Right. Well, I wouldn't care anyway. If I
Yeah,
want to dance on the streets, if people
I,
don't like it, that's their problem, not mine.
I like to sing. Um, Walking, music, dancing, singing. Those are pretty much my coping skills. And binging on new series or even old series like Criminal Minds is one of my favorite shows, and I probably watched that 3 or 4 times over.
Wow.
Bones is another one. I've always been interested in like sciencey things.
Okay, time to plug the business. We're going to plug the business.
All
I'm
right.
going to put a banner up here. Anybody wants to be healthier, this is a good place to go. sunshinentc.com.
It is a very good place to go. Um it has he has good quality products. Um and I will say, talking to other users, now I can't use the products because I don't absorb pills or medications like that. So all of my medication that I have either comes in a liquid form I can shove through my tube, or it comes I'll put it in a syringe with water, cap it off, and I'll let it dissolve. But everything goes through. I have what's called a DJ tube. It has a gastric port and a jejunal port. Everything goes straight into my intestines. Um, the thing about that is when it's going bypassing your stomach and it's not being absorbed by your stomach acids and stuff and your bile, it's going straight to my intestine. So it hits a lot harder than, if you were swallowing a pill.
Kat says she just started taking CMOS. I think Kat's taken almost everything in my store, or a lot of it. She's taken a lot of it.
I've heard so many good things about sea moss. The first time I saw sea moss was actually on Etsy, and it was like gummies. And
Yep.
but for me, if I would take sea moss, if I would buy it from you or even on Etsy, it'll just sit in my stomach. I won't
Right.
it, nothing good is going to come from it.
It really depends on what you're trying to do, Lisa. You know, like I always say, if you're in any kind of pain at all, turmeric's probably the best thing in my store. Sea moss and ashwagandha are super good. Ashwagandha is a adaptogen, so it can help you with a lot of things. It just
No.
helps you. I
Yeah.
mean, I don't know how to explain it. It helps you
So
adapt. So
me, for instance, now I can't take any anti-inflammatories because I have gastroparesis. So things like, so turmeric is an anti-inflammatory. So
right.
me, that's off the table. Ibuprofen, Motrin, your Motrins, your Advils, stuff like that, off the table. Acetaminophen, so like your Tylenol, for me, I can take that. Um, I also do rely, because I have such, from gastroparesis is it's painful. I'm not going to tell anybody that it's not painful. I have they labeled it as chronic pain syndrome. So I have severe pelvic pain, and I have pain from my gastroparesis, which I rely on a low dose narcotic for. And
Do you have the chronic compartmental?
so
You really should watch that video that I did with Becky, because maybe you need ketamine.
so there's CRPS.
Yeah.
I don't have that. That normally affects like your limbs and stuff, but they also have something called chronic pain syndrome,
Right.
and that is what they labeled me as having.
Did you have that before all this other things happened to you?
So I have endometriosis, and that's initially why I had the hysterectomy. Um, if anybody has endometriosis and you're thinking of having a hysterectomy, the only thing it is going to do for you is it's going to stop you from having periods. That's the only thing it's going to do. It does not cure endometriosis. The only thing that it does cure is adenomyosis, which I also had. And the only reason I know that is because I had the hysterectomy.
How do you treat your pain?
I treat my pain with a narcotic pain medication, and I treat it with Tylenol.
Okay. So why did they do the hysterectomy if it wasn't going to help you?
So when I so the year I had my hysterectomy, I went in, I was trying birth controls, extended birth controls. Now I couldn't take the pill, and I was very, very much not going to use an IUD or the implant that goes into your arm. I said no, it wasn't happening. We were going to try to put me back on the birth control patch. And I had talked to somebody before my appointment, and I was like, I'm very much done with this, because I would have periods or menses that would knock me out of the park for a few days. Like, I had very heavy bleeding. I didn't want to go out into public.
I'm laughing at Cats. She said it took her a while to get pregnant, and then she just can't stop.
I was also having a very hard time with fertility. And I was like, I'm done. I just looked at my provider and I told him, I was like, I don't want this anymore. Take it out. He asked me twice if I was sure. I said yes, both times. And I went to the room where you schedule your surgeries, and within 30 days, she was gone.
Wow.
Um, I had an LVAH type hysterectomy. There's different types of hysterectomies. There's a laparoscopic hysterectomy. Mine was I had a laparoscopic vaginal assist hysterectomy. So he used the laparoscope, but everything was taken out through my vagina. And now I have what's called a cuff at the top, because if you don't have a cuff, all like your intestines and all of that will fall through your vagina.
Oh boy.
Yes. Um,
Oh wow.
so I have what's called a cuff. So basically he used a mesh that dissolved to hold my organs up, and then he sewed it shut and we called it a day. And I went to recovery. Then I went to a room where I was admitted overnight. Some people have this surgery and go home the same day. My provider was very adamant I was not going home the same day. Um, Actually, any procedure I have besides my tube changes, like if I have to have a surgical procedure, it's basically written in stone. I don't get to go home the same day.
You're amazing, Marissa.
I don't think so. I just think that
You are amazing. Who thinks Marissa's amazing?
I see you counting.
I want to make sure they're listening.
Does anyone
Write the book.
write the book?
They
Does,
want the book written.
does ask them if they have any more questions for me if they can't hear me, which I'm pretty sure that they can.
Oh, they can hear you. I'm pretty sure they can hear you. Anybody have any final questions for Marissa?
Ask the questions.
They're awful quiet. Maybe they're watching the basketball game.
Yeah.
Okay. Well, thanks for coming on, Marissa. I really do appreciate it.
Anytime.
We'll have you on again. You know we will. One of these days, I want to have more than one of you on at once. I think that'd be kind of fun.
You should get, so the other person who has a feeding tube, what kind of feeding tube do they have?
I don't. She says, I wish you were around when Tyler had his tube. I don't know because they hadn't got it yet. You can find it. It's the one that Julie is her name. And I just released her interview today. So you can see it.
So I will say, if any of you are going through something where you need a feeding tube, or anything like that, there are ways to get in touch with me. I don't have, sometimes I will be live on here. I don't have a problem talking about it. I will say some people go from nasal tubes before they end up with a surgical tube. I didn't have that happen to me. I went straight for a surgical tube. And I will say that there is maybe a 0.5% chance that I'll get rid of this. More than likely, this will be here for the rest of my life. And I'm very much okay with that. But if you have kids who you think need a feeding tube or whatever, and you want somebody to talk you through it and ask me, how you approach your doctor with these concerns, come ask me.
Yeah, just leave me a message and I'll get you in touch with her.
Yeah.
And
He has
I mean,
my
that's probably the easiest way.
email him. He has my number.
Yep. I can always get a hold of her for you.
Yeah.
Okay. Thank you, Marissa.
You're welcome.
Thank you, everyone. Thanks for coming in.
Mhm.
We had 5 people in here the whole time. That's good.
Bye, y'all.
I will see you guys soon. I'm Pharmacist Michael. Be happy and be healthy. Bye, everyone.
Bye.